Good afternoon and welcome everyone. Thank you for joining us for today's webinar. My name is Thomas LaVeist, Executive Director of Partners for Advancing Health Equity, and also Dean of the Tulane University School of Public Health and Tropical Medicine. The Partners for Advancing Health Equity, or P4HE, is a national research learning collaborative based at Tulane School of Public Health and sponsored by the Robert Wood Johnson Foundation. At P4HE, our aim is to bring together the various sectors that are working on health equity, including government, academia, community-based organizations, philanthropy, and the private sector. We convene these sectors to work together to better understand critical issues related to attaining health equity. We do this in part by providing spaces for activities to engage with these groups and insightful conversations on timely topics and promote actionable solutions. Today, we're going to talk about a critical component of health equity: housing. Housing is a broad topic that can include multiple dimensions, such as homelessness, housing affordability, housing quality, gentrification or displacement, housing discrimination, predatory lending, investor-driven pricing surges. The number of homeless persons in the United States was rising even before the start of the COVID-19 pandemic. A key driver of homelessness is housing affordability. Home prices and rent skyrocketed during the pandemic. Scholars and activists have highlighted seriously inadequate housing quality, including one of our panelists today, Frank Southall, here in New Orleans and in cities, suburbs, and rural areas around the country. Unsafe conditions in rented apartments impact health in numerous ways. Systemic racism is the root cause of racial health inequities and housing inequities as well. These include systemic housing discriminations, including instances of discrimination in home appraisals. Housing-related health inequalities impact Americans across the life course. And because housing is an important determinant of health, it's critical that we identify the next steps in solving housing inequalities. This conversation will build on what's already happening across multiple sectors and push us forward. You can join the conversation with your questions and comments through the chat and beyond the webinar on Twitter and by using hashtag partners, the number 4, HE. That is the word partners, the number 4, the letters HE. Now, I'd like to introduce our panel for today's conversation. Anna Rausch is Vice President of Program Operations for the Coalition for the Homeless. She's the lead agency for the TEX 700 Continuum of Care, AKA The Way Home. She works out of Houston, Texas. Sydney Shivers is Deputy Director of the Mayor's Office of Community Assets and Investment here in New Orleans. And Frank Southall is Organizing and Community Engagement Manager at the Jane Place Neighborhood Sustainability Initiative in New Orleans. Thank you all for joining us. Let's start with a question to Sydney. Sydney, can you talk a bit about what you see as the issues, housing and health, and housing as a human right? What do we mean by that?
Sure. Good afternoon, everyone, and thanks so much for hosting this wonderful panel. So the way that our office and that I, as an urban planner, like to think about the importance of providing safe and affordable housing is that really in the system that this country has created, housing determines so much about the access and predictors of success that people have in other areas of their life. Unfortunately, due to historic systemic racism and disinvestment in communities, not everyone has equal access to investments and amenities in their neighborhoods. And so we really seek to ensure that housing opportunities are being created in areas where folks will have access to transportation and jobs, and also the things that public health experts are looking at all the time: access to green space, good schools, grocery stores that provide a range of healthy and fresh foods. And then conversely, really, we try to bring amenities into areas that have historically been underserved, understanding that we can bring amenities into neighborhoods where low-income housing or affordable housing already exists, and enhance the quality of life and health access for folks in that way as well.
Thank you. And Anna, what's the view from Houston? What is the issue here? What is the issue as it relates to health and housing?
Well, I think one of the things we like to do is point it out as far as cost savings to the taxpayer, right? Because housing is a human right. Everyone deserves affordable and decent roof over their head, to feel safe and food in their bellies. And really to expect someone, we work with the homeless population, and to expect someone to be able to climb out of that and get a job and go to all your appointments. If you're living under a bridge or in a car, it's really, really hard to do that. But when you factor in how much it costs for an individual to continuously cycle through the emergency room for regular medical treatment, to be arrested and cited multiple times because they're sleeping on the sidewalk, in and out of jails and warrants, all of that costs hundreds of thousands of dollars to the average taxpayer. Here in Harris County, Harris County did a study, and it's around $70,000 to $90,000 for someone to remain homeless based on all of the things that I listed, but only about $20,000 to house someone in supportive housing for a year. That's rental and supportive services. So do the math, and per person, you're saving quite a bit of money. And we realize that housing stability, supportive housing improves lives and generates cost savings to all the public systems. People that are in supportive housing, they have housing stability, they increase employment, they increase their income, they access all of the necessary services, like Cindy mentioned, mental and physical health. School attendance is better for children that are experiencing homelessness after they get housed. And then, of course, there's the decreased use of the homeless shelters, which costs a lot of money, of hospitals, emergency room visits, jails, and prisons. So to me, it's pretty simple. Even though, yes, it's a human right, it also does have a lot of cost savings to the community as a whole.
Yeah, I think that's really important, that there is an economic argument for why we need to address this issue, as well. Yeah, so Frank, your thoughts?
Yeah, pretty much very similar to what everyone else mentioned. We believe that housing is a human right. We believe that, without safe, equitable, affordable housing, you really can't address any of this issues that people are dealing with in terms of their mental, emotional, physical health. We see this issue largely driven by policy. We analyze and look at our other G20 country peers, and we see how much you're spending on housing, how much you're spending on emotional and mental health care. Their health systems are completely different, and we see better outcomes in terms of housing overall. Even within the United States, Louisiana is far behind other states. Our city generates very, very little funds for rental assistance in building and renovating affordable housing. And so that's something we're really glad that's starting to change. There's a lot more awareness, both from community nonprofits and city government, that we need to invest more in housing. So it's very exciting, and change policies as well.
So Anna, tell us about about the work that you're doing there in Houston. How do you work with people and organizations from different sectors to address homelessness in the Houston area?
First, we start with our Continuum of Care Steering Committee. So the Continuum of Care for us encompasses 3 counties, Harris, Fort Bend, and Montgomery counties. It's about 3,700 square miles. It's very large. But the COC Steering Committee is the body of individuals that govern. They're the board or the government entity of the Continuum of Care. So everything that we do, we work with our partners. We're very transparent to form work groups and get work done. And the work that come out of those work groups goes to the steering committee for a vote. And so the steering committee is made up of people from all adjacent systems. We have the VA, we have the local, the county hospitals, the largest mental health provider. We have people with lived experience, and we have partners that were voted into the steering committee. And so it's a good way. We have both public housing authorities, Houston and Harris County, And it's just a really great way for those entities to stay connected with what's happening in the continuum of care as far as homelessness is concerned. Because if you don't keep those individuals tied into what's happening, then it's often is where we start finding gaps in the systems that feed into homelessness. There needs to be a lot of work that goes into those as well. And so from there, we have a really great collaborative here in Houston. We have a can-do attitude. We all work together. And so we have regular steering committee meetings where all those individuals attend. And then weekly, we have work groups with our partners. We work with the city, the mayor's office, as well as the county commissioner's office. Both housing departments are very in tune with the continuum of care. We help them. We help provide narrative to the action plans and the yearly plans that both the city and the county put out. We put our homeless statistics numbers in there. And so we know that, we need X number of units of permanent supportive housing or X number of units for rapid rehousing, and how many youth are in the system, how many families need housing. And so when those funding opportunities come up, then those entities will come to the coalition as the lead agency to ask for our help and how we can best implement those. We're very data driven here. We look at our numbers to make sure that the decisions that we're making is the best for the community. And then from there, we have just everyone working together to truly address the crisis that we're having. We've decreased homelessness by about 63% since 2012. And we've been pretty lucky here in Houston as far as affordable housing is concerned, because the cost of living has traditionally been less than a lot of the major cities. Even though we're the fourth largest city in the US, we still had a great inventory of apartments that met the HUD fair market rent requirements. But we've housed so many people now, over almost 26,000 since 2012. And just in the 2 years of the pandemic, we've housed close to 9,000 individuals. And so we're steadily using up all of the affordable housing units that we have here in Houston. We have a fantastic landlord engagement team that goes out and recruits landlords. They explain the process for how a housing program works and how the individuals that are going to be in those programs are going to be receiving supportive services. So it's not like we're just going to put someone in an apartment and not ever, talk to them again. They're going to be supported throughout their entire housing process. And then we report these numbers directly back to the entities that support us for funding. So the funding that we recommend, we then we pull the data because we're the homeless management information system lead agency as well. So we're able to pull that information to report back to the community as far as what's happening and how the numbers are going down. We also really believe that we're addressing unsheltered homelessness by clearing encampments with housing. We don't want to move individuals from one encampment to another because they just come back. And these are human beings that have nowhere else to go. So it doesn't make sense to continuously criminalize them when they're trying to survive. And so we have an entire process where we work with the Houston Police Department as well as the Harris County Sheriff's officers. They have homeless outreach teams embedded in both departments, and they have mental health providers that ride along with those support teams. And so they actually help us during the process of decommissioning an encampment, which takes about 4 to 6 weeks. But we have successfully closed about 57 encampments in the past 2 years. And we've actually written a manual on how to do this effectively with housing. And we've been sharing it with other cities across the nation. So it is possible for everyone to work together, towards a vision. It wasn't always like this here in Houston. In 2011, we had the 6th largest homeless population in the nation. And we were identified as a priority community by HUD, but that led to the system that we have now where everyone is in alignment and not working in silos, making sure you're providing the services to really help the most vulnerable and not just cherry picking and helping the people that know how to navigate the system.
Mm-hmm. So that's actually quite an impressive improvement you had in the reduction of homeless people. Back in the 1980s, a million years ago, when I was beginning my career, I started out working with homeless people in New York, which is where I'm from. And at that time, I had a case. I was a social worker. I had a caseload, and I was calling on, people who were living, who were unhoused in the city. And at that time, I would say the majority of cases that I saw, well, they came into really three categories. It was substance abuse, people with serious mental illness and who are no longer in treatment, and domestic violence. And I'd say domestic violence was a pretty substantial portion of the population that I encountered. How does that differ, or does that differ with what you're seeing today here in New Orleans? So Sydney, how about you take this one?
Sure. So I really appreciate that you spoke to sort of the efficacy of breaking down silos and collaborations for your work with the COC in Houston, Anna. I think that, the housing landscape is so complex. We can't do this work in silos. And so that's really what our office and the mayor's office has been set up to do. Anytime we're contemplating new land use strategies or housing policies, we seek to build connections across disciplines and internally within the city. Sometimes departments don't always talk to each other. We bring folks to the table to sort of vet and talk through new ideas and provide feedback so that we're able to strategically address the needs of the city. So I think one way that we've been doing this recently is with the Healthy Homes Ordinance, which I'm sure we're going to hear much more from my friend Frank in a little bit, but the Healthy Homes Ordinance was introduced by City Council about 2 weeks ago by Councilmember Morrell with full administration support. And this ordinance really seeks to hold all landlords in the city accountable for meeting a discrete list of health and safety standards in all rental properties. And then really it gives the city teeth to proactively inspect rental properties and ensure that there's a way to penalize landlords that are failing to come into compliance over a period of time. So this is council's policy, but absolutely the collaboration with the administration has been in effect. This is not the first time this ordinance has been issued. In fact, the mayor, when she was a council member, brought up some similar legislation, which unfortunately was not successful. But we really think that this time around, there's a key policy window to see some success. And so from the administration's end, we've been trying to think proactively about how this ordinance might impact mom and pop landlords or owners of smaller rental properties who really do need some support and additional incentives, whether because they're low income property owners or landlords who have inherited property and want to put the other side of their double back in use. Or they just need a little bit of incentive to get cash to fix a roof from a previous storm or wind and rain damage. So we really brought people to the table to discuss a pilot program to ensure that those property owners are getting resources to come into compliance. And so we pulled in the Louisiana Fair Housing Action Center, Frank's organization, Jane Place, different actors from the city, the Office of Safety, the Department of Safety and Permits, the Office of Community Housing and Investment, the Office of Housing and Community Development, which would be leading on this program, the health department, and then several other actors in the private sector, including current landlords and those who assist current property owners with rehab, to discuss what a series of supports would look like that really meets this need and allows properties at this scale to come into compliance. And then another way, I'll just quickly add that our office works to partner with other agencies and actors is through the redevelopment framework, which is a process that has formalized a partnership with the city and the New Orleans Redevelopment Authority to bring city property through a development process that leads to public benefit, thinking about creating an ecosystem of housing where we're bringing affordable housing into high opportunity areas and amenities into areas that are lacking and access to certain needs like childcare or grocery stores. This allows the city to really prioritize the mayor's priorities for these types of things, working with Nora as the redevelopment arm. So we're very excited. The old firehouse at 2314 Louisiana is going to be developed by some local developers, Home by Hand and Alembic Community Development, providing permanently affordable housing on the second story and childcare for the Central City neighborhood on the ground floor. And they were just awarded this bid. We're looking to bring more housing opportunities through this process in the coming year. But really this partnership with Nora, the private-public partnerships through the, I'm glad to see that folks are excited about the firehouse, the public-private partnerships through these RFPs are just critical. And we vet all of those properties to make sure that they're really meeting strategic housing needs. So when they go out for RFP, we have a clear idea of what type of housing opportunity they might be able to meet.
Yeah, it's really interesting. Just yesterday, I noticed that firehouse driving down Louisiana and said, well, this is a really prominent location. They should really do something with this. And it's good to know that they are doing something with that building now. So Frank, tell us about your organization. Tell us about Jane Place. What is your work?
Yeah, so Jane Place Neighborhood Sustainability Initiative, our full name. We're a community land trust housing rights organization. We build permanently affordable housing within our land trusts in Mid-City. And we also conduct organizing, policy, advocacy, education work, and research around all housing and justice issues. Principally right now, we're focusing on evictions, short-term rentals, and some other issues as relates to housing inequity. One of the things that we've been drawn to in City Mission, the piece around the city getting involved in quality of life issues that renters are facing. We've become pretty much obsessed with tackling habitability standards, in part because we created a hotline at the beginning of the pandemic. And the number two things that people would tell us via the hotline were, one, they didn't have access to legal representation in eviction court, or they couldn't get in contact with legal aid and other legal entities when it came to house issues. And then two, habitability standards. And working with the city and city council, we solved the first one with right to counsel. So now we have enhanced legal education around renters' rights. We have more lawyers on the streets, and just a lot more outreach. And via our eviction court monitoring project, we're already seeing the fruit of that labor, and that more people are showing up to eviction court. Better outcomes are occurring in terms of delayed evictions or evictions that were faulty being tossed out. And we hope to see the same thing with healthy homes. I'm really proud of the city. If we create this healthy homes ordinance, if it gets passed by city council, we will be one of the few cities in the Deep South to have a holistic, comprehensive habitability standards ordinance, which will go a long way to not only just protecting renters, but forcing some of the bigger bad actors, these multinational corporations that own, 400 unit apartment complexes in New Orleans East and Algiers. It's going to force them to reinvest that money back into structures. We do a lot of organizing these complexes, and what we see is that ultimately anywhere from a fifth to only a third, half at the most blighted properties are occupied by renters.
Looks like we've lost Frank. I'm sure he'll come back in. So let's turn to Anna. Talk a bit about the drivers. What are the drivers of homelessness?
There really hasn't been a lot of studies done on what contributes to homelessness, but I think of the little research that's out there, and just from talking to individuals, so many people that we've housed, the biggest contributing factor is financial crisis. Some people, unfortunately, a lot of people are living paycheck to paycheck. Poverty is still pretty high in many communities. And so it just takes one broken vehicle, one sickness, one pandemic to cause someone to become homeless. There's a lot of stereotypes around homelessness, that people that are homeless don't want to be housed, that they want to be homeless, they want to continue to use drugs, that they're severely mentally ill. But when you think about the trauma that someone goes through when they're experiencing homelessness, that all of those things, if the individual already has a mental health concern, or if the individual already had some kind of substance abuse issues, all of those things are compounded by the mere fact that the person is now homeless. And so the second thing after that, for sure, is affordable housing. I was on a webinar, I guess it was last month, with the National Low Income Housing Coalition, and someone shared a slide of the number of housing permits that had been taken out in various cities across the nation, starting in the 80s all the way through today. And it shows that the cities with the largest amount of individuals experiencing homelessness had the least amount of affordable housing construction compared to other cities. And so we're at a critical point right now where some decisions have to be made about adding affordable housing to every single city. We can't say that enough here. Even here in Houston, we're starting to experience that tightening of the housing market. We've housed the majority, I would say about 75% of the people we've housed are single adults or couples that are using a one bedroom. And those are very few, scarce now. And so all of the properties that are available just don't meet the fair market rent, or are requiring people to have 3 times the amount, make or earn 3 times the amount of the rent. And that's just not going to happen with people that are in a financial crisis. So I would definitely say that affordable housing is the big one right now. We have to do better.
Mm-hmm. Is that what you're saying here in New Orleans as well? Is it really just is an economic issue mostly, or affordability issue? Sydney?
Yeah, absolutely. I think it's definitely a both and. I'm not an expert on houselessness in New Orleans. We tend to look more at macro level policies, but certainly these do impact the availability of affordable housing, like zoning and housing quality standards for rental property, some of the things we've talked about. And I think one connection that I'm seeing that a big focus of the mayor's administration and my work is on is the wealth gap, right? I mean, when someone is in financial distress, if you don't have access to a safety net through generational wealth or family members that can provide some support, you're really on your own, and then the system has to take over. And I think we see that happen with unhoused folks a lot. But by working towards helping people save money through providing affordable rentals and certainly have access to home ownership, because that is the #1 way that Americans build wealth. This is critical. And of course, this is also absolutely critical for racial equity in our country as well. So I think wealth is pretty foundational to a lot of this.
So Frank, I see Frank has rejoined us. So when we lost you there, you were talking about Jane Place, and I was going to ask you to say a few words about the healthy homes that's being going through the city council right now. Can you talk about that? How will that make a difference?
Yes, sorry everyone, I had internet dropped at my office. So the Healthy Homes Ordinance will ultimately create a set of comprehensive standards that all landlords and property owners who rent out their units will have to abide by. Ultimately, the thing that we're interested in is the return to commerce of lots of properties that aren't being maintained. If you drive throughout New Orleans East and Algiers and even parts of the historic core of our city, you'll just see big multifamily unit apartment complexes that are completely abandoned, or half units are abandoned. We know that if people were forced to make repairs, with the money they're receiving, that they would, and ultimately that brings more units into operation, which provides more affordable housing. And this is also an important issue because when we think about a lot of our unhoused community members, people who are, working class, a lot of people are receiving federal subsidies, end up living in these complexes because there's such a housing crunch. So this is about like a return on investment as much as it's about public health, as much as it's about social justice as well. It just makes economically more sense to hold these people accountable in the way that they're held accountable in New York, the way that they're held accountable in LA, Chicago. So I'm really glad, and I'm really grateful that the city, along with a lot of other really brilliant, amazing community partners, are making this happen.
And so, and what about sustainability of these strategies? So, Anna, you have quite a robust set of strategies that seem to be having an impact there in Houston. What do you see as the sustainability of these new policies and these processes that you all have put in place?
Yeah, we are always looking, 5 years down the road for what's going to sustain any programs that we put in place. So, for example, during the pandemic, we created several new housing programs, and some of those we want to be permanent. And so there have been other opportunities with the American Rescue Plan Act, with housing stability vouchers that are coming. And we took those and combined them with services to make sure that the projects are going to, the permanent supportive housing projects that we created are going to still be here several years down the line. We don't want anyone to remain homeless. We're also always looking for new opportunities on the HUD national level. So there's been just recently, we're in the process of the notice of funding opportunity for HUD, and there was another special notice of funding opportunity to address unsheltered homelessness that came out this year. It's going to be due next month. We definitely are going to try to apply for those. They're going to be pretty competitive, but those are the types of things you're constantly having to do so that you can maintain sustainability for your programs. Unfortunately, Houston does not get a lot of revenue from the city and the county. We're revenue capped, and so it's very, very difficult. Aside from the funding that comes from HUD, either directly or indirectly through the state, the county, or the city, to get additional resources. We have gotten support from some of the philanthropies here in Houston. But again, we have a great strategic planning department. My coworker, Jessica Preheim, we are constantly working together to find additional funding to support our programs.
Yeah, I'm always curious from a policy development standpoint about finding ways that we can incentivize private sector to do things that are supportive of good health. And it seems to me that finding, kind of thinking a little bit about how do you do that, that is what produces sustainability, because people have an economic incentive that they will engage in that behavior, but the behavior we want them to engage in is, health positive behavior. Yeah. How do we incentivize? Because that is really the only thing that's going to build permanent sustainability, as opposed to grants through philanthropy or the political wind shifting from one election to the next.
So there's a few examples that I can think of. One is the social impact bond that Denver did a few years ago. I think the Urban Institute wrote an article about it, but they basically got some investors to put in money, and the city would reimburse them for every day that a person remains housed. I think it was like $15 a day. And then I think the last payment is going to come out soon for that entire project. So that was a bond, a social impact bond that was issued out by the city. That those can definitely be replicated if you have the investors in your community that are interested in doing that. Another thing that we've done here, and we only did it one time, was the Medicaid waiver. We created a brand new permanent supportive housing program that did very, very well. It was an integrated care model, and we were able to use the funding from the Medicaid waiver that was out. I think it was in 2015, between 2012 2015. Those are great ways to get sustainability into your programs. Healthcare is a big one. We've tried to work with the managed care organizations to do data matches, and they're willing to pay for housing for their high utilizers. If you can find a way to match the individuals that are experiencing homelessness in your community, or even those that are precariously housed, but they're getting Medicaid or Medicare, and they may have an MCO attached to them. If you can match those individuals that are not receiving care with the MCOs, they're willing to come to the table to provide housing support to make sure those individuals stay connected to housing. So those are just some things that, you know, we've kind of looked at and tried here.
Yeah, that's really helpful to have some specific policies that we know have, or strategies that we know have worked. And so another strategy is community land trusts. And I know, Frank, your organization has worked with that strategy. Can you describe what are community land trusts? How does it work, and how have your organization used it?
Yeah, so community land trust, the best way to describe it with a good analogy is if you think about a savings account where you're putting money away for the future. A community land trust is that way with land. Essentially, though, the difference between the savings account and community land trust is that the people in the community get to decide what to do with the land. And ultimately, most community land trusts are geared towards the preservation and the creation of affordable housing. And basically, with a community land trust, it prevents the land from being sold in the future for more development that's not of affordable nature. It prevents a lot of market speculation. And so that's one of the reasons why when the organization I work for, Jing Place, was founded 14 years ago, they went with the ideal of a community land trust to prevent land in the core of our city from being gobbled up by private developers for luxury housing.
Mm-hmm. So this is I think a perfect segue into another question I wanted to ask you about the article that the piece you wrote for Anti-Gravity magazine. You know, talked about in that article there was a discussion about why slumlords target New Orleans. You know, Can you talk a bit about it? What is it about New Orleans that makes it attractive to slumlords?
I mean, principally, I would make the argument, and many others, that the reason why slumlords are drawn to buying up huge chunks of land is due to the laws and policies we have in the book, both from the standpoint of state government in terms of the lack of comprehensive protections tenants have. You know, you can get a notice to vacate and be evicted and thrown out the door of your house within 10 days. Very few states have such lax policies and laws. In addition, as Sydney mentioned, we're going through this process to create a healthy homes ordinance, aka a rental registry, for first time in our city's history. Most states in the North, the West, the East, the Midwest, they have these policies in the book. So developers from New York know that they can get away with things down here that they can't get away with in New York City or in San Francisco. And then you couple with like the relatively, in the past, affordability of the land. Buying real estate here 10 years ago, 5 years ago was very, very cheap. And tenants had many different options of where to live at. So even a slumlord, they allow a lot of properties sit idle. But if you see the speed up of people trying to renovate some of those big apartment complexes 5-10 years after Katrina, part of it was because they knew that a lot of evictions were occurring in the core of our city, and they knew that they can make a lot of money by bringing people out to the east. So there's all these mitigating factors, but ultimately we chalk it up to laws and policies.
So Sydney, sort of, I think, naturally goes to you. Kind of what can we do about this here in New Orleans?
Yeah, so absolutely. Frank mentioned that the Healthy Homes Ordinance has multiple goals, one of which is to ensure that there's a accountability system for landlords that are not meeting basic health and safety standards. And it's also a rental registry that provides the city with data on what type of housing we have available in the city, in the private market, which can be quite hard to capture. And so I think that this policy is incredibly important as we think about our housing supply and creating more affordable opportunities, and also looking at what we have to offer folks that might be facing displacement or eviction. This policy will create a data base of resources that are resources, meaning housing stock, that are available to tenants. And I think that the policy is very smart in that it is self-sustaining. All landlords are going to be required to pay a small fee to register. And part of that fee will be in the ordinance as written today, is going to be set aside for an anti-displacement fund that ensures that tenants that are living in properties that are egregious, to the extent that they've been deemed unlivable, will have a cash payment to take to find housing opportunity elsewhere. And then again, I think Frank touched on this, but again, just focusing on housing preservation as well as development of new property is critical. I mean, we live in a city where over a third of our housing stock was created before 1940, and you add in several years of hurricanes and weather, and it leads to a lot of poor housing conditions that can be difficult to keep up with. So more resources. The Office of Community Development is doing a great job rehousing people, and now pivoting to make sure that there are more resources available to property owners and homeowners to maintain the quality of their property as they age.
So I'm told we have a few questions in the chat. Can we have those questions come forward, please?
Sure. Hi, everyone. This is Jackie from ICF. We have a couple questions that have come in through the chat or mural. I guess the first I would pose is for all speakers, how can we think about policies and practices in the housing space that can improve health equity overall? Would anyone want to take that?
Can you repeat that again, Jackie?
Sorry, did you ask me to repeat it, Frank?
Mm-hmm.
How can we think about policies and practices in the housing space that can improve overall health or health equity for communities? I think Cindy, you were going to share. Okay, Sydney,
Yeah.
I'm sorry, go ahead.
I would just say it's important for policymakers and community members to be thinking about envisioning new ways of living. Frank just spoke to the importance of community land trusts as a way to build wealth and have secure housing over time. And there are a lot of ways that housing opportunity, especially for renters, is codified in our zoning ordinances. And there are a lot of opportunities to reintroduce more diverse housing stock that can be locally owned, that can be within the price range of residents of New Orleans, but still provides affordable rental opportunities. So for example, we last year passed a reform to zoning that allows triplexes and fourplexes to be built in our historic neighborhoods as they had been for many years prior to more recent downzoning that actually prohibits them. And this ordinance allows developers and property owners to add additional units to existing properties or build triplexes and fourplexes, so long as those properties provide at least one unit of affordable housing. And this really speaks to the importance also of taking an inclusionary housing approach to housing policy as much as possible. We also have adopted an inclusionary zoning policy that requires larger developments in strong market areas in the CBD, Marigny, French Quarter, and parts of the Treme and Bywater as well, are required to provide affordable housing as new units are coming online. And there are incentives for them to do so through tax exemptions, not tax exemptions, payment in lieu of taxes, the pilot program with Finance New Orleans. But I think, incentives are incredibly important to steer the private sector towards providing some level of affordability with new units coming online.
Yes, thank you for that. Does anyone else want to address the question? Any of the other panelists? So Jackie, was there another question in the chat?
Sure. We have a couple more. I know we're running short on time. I'll pose, I guess, a combined question for Anna. This was related to a lot of the success stories you were sharing earlier on. So one person asked, and I know you addressed a bit in the chat if you wanted to go a little deeper with that, about strategies for replicating that? And then someone else also asked if applicable, how, when you think about these strategies that you shared and success stories, how have you engaged people with lived experience in that work?
I'll address the people with lived experience first. So we have standing seats on our steering committee for individuals with lived experience. We also have a consumer advisory council group that we run all of the decisions that impact direct delivery of services to clients. We run it by them. And we have a great team on staff that works to make sure that there's understanding and every step of the process is explained. For example, we're in the process of evaluating our prioritization tool. And once we get all the data and all of that, we're going to meet with the Consumer Advisory Council to make sure we're asking the right questions as far as vulnerability goes, so that we're not missing something as far as how we ask people how they're experiencing homelessness. As far as replicating, it sounds a little cliche. I put this in the chat, but it really is about collaboration. Before we did this, before we started collaborating, everyone was working in silos. So there were a lot of partners that were doing their own thing. There were partners that were doing the same thing. And because we weren't communicating, we didn't realize that there was a duplication of services. Money was not being spent wisely. There was a lot of funds going back to HUD because the people that were the most vulnerable were not being served. And so when we got together in a big room and everybody kind of shared their concerns and agreed, it's better. Collective impact is important. When you're working, everyone's working together. Everyone wants their own priorities and opinions shared. And so a transparent process really does work to help engage more people. And so that's what we really strive for here in Houston, is transparency at all costs. There's always going to be the perception that you're not being transparent, but if you keep trying to be as transparent as possible in everything that you do, it really, really does help a lot, and it helps with buy-in on what you're trying to do. And then, of course, once you start doing things, then the more you succeed at something, then the better it is to convince other people to join in. And when we always give credit where credit is due, there are some partners that are doing fantastic work. And then also there are smaller partners that are trying to come on board, and we have to think of strategies to better engage with them, support them financially if possible, and help to ensure that those businesses or those organizations that are mom and pop nonprofits have the opportunity, as well as the bigger communities. So, and then the last thing is really, really just look at your data. If you're seeing a lot of individuals experiencing homelessness that are, let's just say, veterans, I'm just using this as an example, but you're putting all your resources into not serving veterans, and it's just going to increase. The number of veterans that are homeless are going to increase. So look at what your data is telling you year to year. What are the trends that you're seeing? How many people are coming into your system? Where are they coming from? And then of the resources, of the services that you provide, what's effective? If you're serving people in rapid rehousing, are they exiting after a certain amount of time and they're exiting to negative exits? Then that means there's something happening, during the process of providing the service that's not working. So we've done a lot of that data analysis here. We really love diving into our data, and it really has helped us make the best decisions for our community.
Thank you very much, Anna. And so we're running low on time, so we're going to just throw out this last question, but we need this to be just a quick hit, so we can just get quick responses to this last issue. So as you know, P4HE works together to try to align different sectors, academia, community based organizations, government, private sector, philanthropy. As we wrap up, talk to us about these different sectors. Address any sector you'd like, and kind of what do you want them to know about this topic that maybe they're not as familiar with, or what from your sector do you think people in other sectors should be thinking about? Let's start with you, Frank.
For me, government has to organize resources better to, build more housing, to be more effective in stabilizing folks. And we also need private donors to provide unrestricted aid so we can meet the needs of everyone in our community, including undocumented immigrants.
Okay, thank you. Sydney, just a few parting words.
Sure. I think that the survey response regarding what are the most important solutions for housing really said it all. Housing solutions require a both and approach. We need financial resources, we need collaborations among sectors, and we need support for policy reform. So to those of you on the call, when we were logging in, I saw a lot of folks from the health sector who work in hospitals and various communities. Think about the ways that your clients or the communities you work with are impacted by lack of housing access, and where you would like to see more housing opportunities in your community. There are a ton of ways that hospital industries can leverage their resources to provide workforce housing and get involved with advocacy. And so I would just encourage you to look for partnerships with the cities that you're located in, with the city planning commissions and the Office of Community Housing and the CDCs to be an advocate for housing through the public health lens as well.
Thank you. And Anna, can we get like a 30-second? We've got just about that much time left.
So when you're thinking about law enforcement, all sectors of law enforcement, think about the policies that you're putting in place that might inadvertently impact people that are experiencing homelessness to have more and more charges on their records, which would prevent them from getting into housing, which would lead to the housing or health equity and all of those things we want people to succeed in housing.
Okay. Well, we hope you found this timely and illuminating conversation, and that you'll join us as we continue our collaborative learning through our upcoming activities. Thank you to my guests, Anna Rausch, Sydney Shaver, and Frank Southall. Please mark your calendars for Tuesday, October 25th at 1 p.m. Central Time for our next webinar on food, security, and nutrition. And if you haven't become a P4HE member, please join us for our kickoff meet and greet on October 4th and the first interactive session on November 1st. Be a part of these conversations. Visit our website for information on P4HE and upcoming events, how to become a member, and follow us on social media. Thank you for joining us. Looking forward to hosting you at our upcoming events. Goodbye.